Here we are. It's April 27th, and we've been sheltering based on our governors and our state government recommendations since March 18th. So we've been at this about 6 weeks or so. I'm not sure how you're doing, but it feels like it's gotten deeper, I think, in terms of how it's affecting all of us. And certainly that's what I'm hearing out there from all of you, or a lot of you in the field, and how it's affecting us, and looking at how much of this is going to be part of what's next. You know, what's the new normal that we're actually grappling with? And I think that one of the things that becomes really a challenge is that a sense of optimism is something I think that most of us and all of us believe is part of being healthy. And that is being able to look to the future and say, hey, what can we look forward to? What can our future generations look forward to in terms of a healthy culture? That's what I think becomes really concerning with something like this, which can seem really unique. Is this how the world has shifted on its axis in some way that it hasn't before? So I think one of the things that becomes important to me is to take a look back in that historically, this was how the world turned. People were dying as much from measles as they were from smallpox. So there's just a lot of historical precedent for what we're going through right now that we've been literally immune from based on our protections from public health, which includes, importantly, immunizations. And with respect to the coronavirus, whether it actually mutates like the flu virus does, or whether it's going to be stable, more like, say, measles has been, immunization from this should be the ultimate treatment. If we have to get re-immunized because it mutates, like we have to for flu virus, the virologists are telling us this will happen. What I want to come around to here is maybe I'm trying to convince myself, but I think we all need to come around to is a sense of the optimism that is part of saying, this has been part of our human history, relearning about this kind of pandemic and this kind of what I've heard called disaster in terms of what it's done for so many elements of what we live with, our economy and our own clinics and health centers, and how they've been really dreadfully affected and in many cases are really threatened with closure from the lack of financing for what we've been able to do because we're all closed. One of the things I think we need to advocate for with what's next and looking at how we can be optimistic about our future as health centers and in a larger sense what our healthcare system and then our economy really can look at from the view of healthcare is how we can continue to use some of the tools that have had to be developed during the pandemic moving forward into the what's next. In other words, not necessarily if there's a stable new normal that's going to be happening in the next 3 to 6 months, let's say, but that as we transition into a next phase of moving out of this pandemic and the number of cases based on how this virus works, will start to mitigate further and further. And we'll get down to 0 deaths and eventually 0 cases over a period of time. And then what happens? How can we work in a way that is new, recovers some of the ways that we worked before, face-to-face, within walls care, but also taking a look at how we can maintain some of the appropriate and really effective virtual care and get compensated for it. So one of our jobs at CPCA and NAC are looking at, and we'll continue to look at, value-based care, how we can get compensated in new ways for the value that we bring to the kind of care that we're giving. Telephonic care has been very effective when it's been done well. And one of the things about that is that the more we do it, the better we get at it. The better the tools are, the better the internet connections are, the broadband, all those things that allow us to be able to do that work. And then telephonic care, being able to get on a phone, being able to actually communicate with patients in real time, and being not to have to sit down at a computer necessarily, but be able to give advice or direct patients in real time and get appropriately compensated for that in some way, in some scheme that actually recognizes the value of each one of these kinds of encounters. They are patient-centric. In other words, that the information that comes from an encounter, whatever kind of encounter that is, gets built into that patient's record, and that no matter where that patient is eventually, that information moves safely with the patient. These are all part of what needs in some way to be what's next in order to improve the kind of care that we're giving. Now, in order to get there, we have some steps to take, and we're hearing about this all the time. How can we get a real sense of what this thing is? And that is testing. How many cases of coronavirus or COVID-19 disease, how many cases of exposure have there been? How many of us either are carrying the virus or have had the virus? And until we can have a playing field that actually has that information to be able to inform it, it's pretty difficult to move forward. We don't know whether we're walking too close to somebody who may be infectious themselves. We don't know who of us is carrying the virus necessarily. We don't know if we've had the virus, which might be done through serology blood testing to find out if we have that immunity to this virus. And oh, by the way, does that immunity protect us and for how long? All it just has to really continue to be part of the tools that we gather to be able to move forward in a responsible way with real science, to be able to open up in a way that feels healthy and effective moving forward. So we've got testing that needs to happen universally. I think our governor in California has said we have about the capacity for 16,000 tests a day, but we need to get to 60,000 tests per day to be able to move to a place where we can get enough testing to feel that we can open up our communities again. In that same light, the concept of contact tracing has become really prevalent too, in which case contact tracing becomes really important. And then what does quarantining mean? How does that affect people? I mean, it could obviously affect thousands of people. And having them be isolated, social distanced basically, it can be shown with testing that they are safe after a period of time when they may well have been exposed. So these are all elements of moving forward. Increase the testing, do the contact tracing, do the appropriate quarantining, open up our communities. So much of this is really difficult and in fact, literally traumatic. And one of the things that we're working on already in some of our centers, talking about trauma-informed care, since this has been hugely traumatic in so many ways, and then also secondary trauma, and that is the trauma for all the people that have been working in a way that is new and really difficult in terms of relearning how to be caregivers and at the same time do self-care. And in fact, here at CPCA, we take this very seriously and are offering some webinars coming up regarding trauma-informed care and also self-care. Thank you very much.
Any other questions that you have, don't hesitate to be in touch with us, our emergency preparedness team, and also myself, Mike Whitty, mwhitty@cpca.org. Happy to help you in any way that we can.